I would walk into exam rooms, and people would have a hard time reconciling me with what they expected. I would do the full intake, physical exam, medical assessment, everything. And at the end, they'd ask, "So when do I see the doctor?" Eventually, I got a lab coat with my name embroidered on it, so there would be no confusion. And they would just keep looking at the lab coat, looking at me, and then they would know there's nobody else I'm seeing after this. It was this extra layer of proof people needed to see. I'm Dr. Woganee Filate, and I'm one of the co-founders of Lume Women Health. I knew very early on that I wanted to be a doctor. I was always drawn to the sciences and had a deep desire to help people. But other than my own family physician, I didn't know any doctors. I had no one guiding me through things like the MCAT. I was just figuring it out as I went. I started with deciding to go to the best science undergraduate program I could find. So I went to the University of Toronto. On the first day, I was so keen, sitting in this huge lecture hall with 1,500 students, and the professor said, "I know most of you want to become doctors, but only this tiny corner of the room will actually make it." It was crushing, like they were killing my dreams on day one. And I didn't get into med school on my first try. I did an extra year of training, then a master's in community health and epidemiology. When I reapplied, I got in. It was a more winding road, but it served me better. I was more focused, more ready. That focus eventually led me into sleep medicine, where I saw firsthand how improving sleep could transform a patient's overall health and quality of life. My path also gave me a broader lens into how systems shape care. In my work as a sleep doctor, I've seen how often women seeking help in midlife are dismissed. They hear things like, "That's just part of getting older. Get used to it." Fatigue, mood changes, trouble sleeping, it's all waved off as inevitable. But when you take the time to listen, those conversations become more productive, and the care actually works. Even I didn't fully understand how sleep changes in midlife until I began treating these patients. Throughout all of my training, I never connected menopause with sleep disturbances, because in medical school, we weren't taught to ask about it. I had to seek out that knowledge myself. The truth is, many physicians want to provide care where women feel seen and heard, but our training and the system rarely equips us to do so. Menopause was barely covered in my curriculum, just a handful of slides over years and years of study. Meanwhile, our healthcare system builds detailed roadmaps for early life and pregnancy with regular check-ins and structured support. But after that, there's a gap. No systematic approach to evaluating or managing a woman's health in midlife, despite the fact that this is when her risk for chronic illnesses, such as osteoporosis, cardiovascular disease, diabetes, rise sharply. That lack of education and preventive structure is exactly what inspired me to co-found Lume. We wanted to create a more intentional, evidence-based approach to care during this pivotal stage of a woman's life. Between myself and my Lume co-founders, we had over 50 years of combined experience in the public healthcare system. And we were ready to change the way we provided medical care. The system is so siloed. As a sleep doctor, I could only treat one piece of the puzzle. If there were other health issues to address, I had to send my patients out with a referral and hope they got the help they needed. So we built a more integrated model. Now I can walk down the hall and speak directly with a therapist, a menopause specialist, or a nutritionist, and we're all caring for the same patient together. We created a single destination for women's health, holistic care all under one roof, and we intentionally designed the clinic to be calming so that women can finally drop their shoulders and feel at ease. When women tell us they don't want to leave because they feel seen and heard, that's the greatest compliment. Of course, building something like this took more than medical expertise. It required learning how to run and finance a business. One of the best pieces of advice I received early on was, don't be afraid to ask for help. I reached out to everyone I knew, my husband, trusted advisors, even insights from books and podcasts. Our bank was also instrumental. They helped finance our clinic build-out and advised us on the best terms, providing day-to-day support. We could always reach out to our advisor directly with any questions or concerns, which gave us the confidence to move forward. It helped me realize that financial guidance isn't separate from healthcare leadership. It's part of building the infrastructure that allows us to serve more women with better care for the long term. And we learned to stay flexible. If something wasn't working, we didn't dwell on it. We made changes quickly, always looking for the best solution, even if it meant taking a new direction. We were building something from scratch, and as physicians, the medical side came naturally, but we had to learn how to run a business, how to negotiate leases and contracts, hire staff, and work with lawyers. There were no shortcuts, just a lot of learning on the go. And honestly, we're still learning. That part never stops. When I left my sleep practice, people questioned it. Are you sure? You have a good thing going. But I was sure, because it wasn't enough for me anymore. I wanted to create something bigger. We wanted to challenge ourselves and step outside of what was comfortable. I've always believed that real change only happens when you're willing to take a risk. For me, it comes back to passion. And having a team that shares that passion, people who all want to do great work, that's something truly special. Equally important to me is showing up as my authentic self, as a physician and as a Black female physician. Representation matters, especially in spaces where women often feel unheard or dismissed. When patients see themselves reflected in their healthcare providers, it builds trust, fosters safety, and creates a deeper connection. That same value of trust has been essential in building Lume. Having a strong financial advisor in our corner was key to our success, especially in the early days. My role as a co-founder is to dream and execute, and our banker's response was always, let's make this work. That kind of support gave us the courage to keep expanding, even when the risks felt high. It allowed us to move from vision to reality. Lume was born out of the frustration with the lack of menopause education in medical training, and out of a deep desire to shift the focus from disease treatment to prevention. It also came from a personal wish to create the kind of clinic I wanted for my patients and for myself. Lume gave me the chance to step beyond the limits of traditional healthcare and reimagine what care could look like when we center a woman's lived experience and treat her as a whole person. As a Black female physician, this work is deeply personal. I know what it feels like to be overlooked, to not be fully seen. At Lume, I bring my full self to the work, and I create space for other women to do the same. That's what drives me every day. The best advice I give future entrepreneurs in choosing a financial advisor is to pick someone who really believes in you and your vision. That is the most important pairing that you can have, and that will help you weather all the storms of starting a new business. And for women, I think it's really important to remember you're never going to feel ready. So there's no point waiting and deferring and putting your dream off months and years down the road. If you have the desire and the willingness to take the risk, you are ready and it's time. I think the best way to know when to take a financial risk versus playing it safe, again, goes back to passion. If the decision aligns 100% with your desire, your vision for yourself and your business, that is worth the best risk. And again, you're betting on yourself, which is there's no greater investment than you and your vision.